On the panel today, we've got Francis from TUC, Elkin, who are representing the families, Professor Gabriel Scally from Independent Sage, and Ned Sand, who spoke first of the campaign, tragically lost their father this time last year. He was also a frontline GP, frontline intensive care unit. So let's start by reading out a statement, and then we'll just take general questions.
Okay. I'll just take this off. Today is nearly 1 year on from the day my dad died of COVID-19. I was working as a critical care doctor in my hospital in the intensive care unit. I'm an emergency medicine care doctor by trade, but I moved into ITU to support the effort. At the same time, I'm also a filmmaker, and I was working on a film for Channel 4 Dispatches about the realities of what life is like in a hospital, and for staff and patients facing COVID-19. The reason why I was determined to make that film was because I was watching a car crash take place in terms of the government response to the real pressing concern of a devastating second wave. It was like watching a car crash in slow motion, watching the numbers go up and yet no measures, no mitigating, nothing whatsoever, still talking about Christmas like everything was normal. Obviously within the hospital we would have loved to have been the wrong ones and everyone else to be right, but we knew that we were right. So that's why I felt it was exceptionally important to document and to be a visual eyewitness to and bring this eyewitness account to the public domain. As I was filming, my life involved filming and then going on to work my shifts. I was self-shooting myself, I'm a self-shooting camera person. But as soon as we approached the last couple of weeks before Christmas, I got the dreaded call, and it was whilst I was filming in my unit, that my dad had become unwell with symptoms. And this is a time when the filmmaker actually dreads when they actually have to become part of the story themselves. I had to make the decision as to whether I wanted to continue to document the film, drop everything and run home, or do I try to do everything? And if I'm asking other loved ones to share their stories of the devastating impact of COVID on my lives, then I felt I had a moral obligation to continue to do the same. So I did continue filming. I filmed in my hospital and then I filmed with my father, and it was possibly one of the hardest things I've ever had to do. And I have filmed in all sorts of situations overseas, in conflict zones, for the BBC and for Channel 4. But working in the NHS during COVID is possibly the hardest thing I've ever had to do, and I'm ex-military, so I can say that with authority. I will never forget the scenes I saw in the hospital last winter, particularly the ones where I was with my father in Queen's Hospital in Romford. It was devastating. The wards were full of desperately ill patients. And I say this with an authentic voice. It conjured up the same feelings of dread and anxiety that I have faced in the front lines of Syria. That same desperation of what on earth is happening, where is help coming from, who is going to sort this out, where is the threat coming from? There was nothing. There really was nothing. You couldn't seek reassurance from anywhere. Staff were stressed out. I'll never forget the look of absolute exhaustion in the eyes of the doctors that came to tell me the news that I knew what they were going to tell me, because again, as I said, I was working in intensive care, I knew the story, I knew what they were going to say. But I also knew that in normal circumstances, my dad would probably warrant a critical care bed, at least within high dependency, but there were none. And as the consultant said, look, I've got 30, 40-year-olds that I'm desperately trying to get a critical care bed for. I just can't help your dad, make him comfortable. And that's what I had to do. Staff were wrung out, exhausted, they were running around, they literally were running around. One of the doctors that came to see me at 5 o'clock hadn't eaten since 7 that morning. This time last year, of course, I had no idea that my family would experience literally this time last year. I was in the throes of filmmaking, that I would experience the same losses that was so desperate, that we were so desperately trying to prevent others from going through. Everybody agrees that this inquiry must be focused on learning the lessons that will save as many lives as possible going forward, so that those scenes of last winter are never repeated. To make that happen, it must place those who have been impacted at its heart, which of course includes those who have tragically lost loved ones. We must not be sidelined in the way that we have been, or ignored, or weak, feeble promises made that really don't lead to any fruition whatsoever. We deserve better. The purpose of this report is to outline the key areas that any inquiry must look at in order to do justice to the cataclysmic impact of the pandemic. Let's take our head out of the sand, let's treat this with the respect that it deserves, and let's deal with this properly with seriousness. I've come back from overseas. I've been filming in Jordan for a couple of months. Their level of seriousness, their level of behaviour towards COVID and containing it is, I have to say, even in the middle of the Wadi Rum Desert, far better than what I have seen in places in the UK. The Prime Minister promised us that we'd be consulted on the scope of the inquiry that we campaigned for. We've heard no details since July, since we first started this. So we've written this report to make crystal clear the areas that the COVID-19 inquiry has to cover. This is, without doubt, going to be the biggest inquiry in British history. We can't afford to get it wrong. And we are not giving it, or I'm going to remove the government, are not giving it the seriousness that it absolutely demands. The COVID-19 inquiry could and should be an historic and positive process that helps the UK to reconcile the potentially avoidable high number of deaths, over 160,000, sustained during the pandemic. It should also be an opportunity to ensure that through lessons learned, these kinds of tragedies never happen again. We hope that this report is a small step in that direction. Thank you.
We'll take any questions now.
Thank you.
Thanks. Hello, Ben Wright from BBC. Hello. When did you last have meaningful contact with Number 10 and the Prime Minister about, as a campaign, about the terms of the inquiry, about who might share it, and where those discussions got to?
I can answer that. I say we've had no meaningful contact at all. We put in our proposals to the terms of reference back in the beginning of July. We've had a meeting with him where he undertook to consult, not just with us, but quite probably widely with the public. And that was it. We've had nothing whatsoever since. And that is part of the reason why this document has been produced, because if the government is not going to have the consultation process which it should have, then we will have to do it for them. And I'd make a follow-on point from that. These aren't the tablets coming down from Sinai in this report. This is the beginning of the consultation process. This is a people's inquiry, and we want feedback from other groups and other people as to what they feel should be in the inquiry, so that the government can be presented with a comprehensive proposal for the terms of reference.
Have you had, just to ask again about the chair, have you had any conversations about names? Because presumably we may get one before the end of the year.
The government has said that they are not prepared to consult on the choice of the chair, although at our meeting with the Prime Minister did ask for names to be suggested to him, but we're now told that was a misunderstanding, as often happens with this Prime Minister. So no, there's no process of full consultation.
Yeah.
I'm very sorry for your loss. Are you experiencing the same feelings of dread about what is about to come because we haven't learned these lessons?
I think what has happened, I think, I'm not going to be critical if it's not deemed necessary. I have to say, as I was watching the news about the latest variant, I was actually quite heartened that there was a bit of a faster response. I was actually expecting it to drag out and there to be a whole conflag before something definitive happened. Obviously today there's mixed messages about people getting their booster and how they can physically actually get their booster. But it reassured me that a strong message had come out on things like mask wearing, etc. However, the fact that everyone was allowed to abandon their masks in the first place was just ludicrous, I think. But heartening to see that coming in today, everyone had it on bar one or two. Do I have the same feeling of drip? Look, it's winter. I've worked in the NHS for 14 years now. Every winter it's bad. It's still early days as to how this variant is going to impact people, whether the vaccines and boosters that we have in place are going to be sufficient. Science and evidence is suggesting, I'm going to leave that to the scientists next to me, but within my medical circles we're hopeful, but I think this is coming at a time where everyone is exhausted. My sisters are GPs, they're absolutely flummoxed, and we've got yet another variant to deal with, and we've got hospitals that are already full, intensive care units that are full of people who have not had their vaccines already. Am I worried? Yes, I am.
I think we're at a serious point, obviously, with this new variant. One of the learning points is to remember what was said repeatedly months and months ago, that we're not safe until we're all safe. And the failure to share vaccines around the world, and the failure of the UK government and other governments to join with the United States, with Brazil, with India, and other countries to have a patent waiver so that production of vaccines could be upped across the world and we could stop the new variants emerging, because the more replication there is across the world, the more chance we have of having a variant. So the UK has chosen to side with pharmaceutical companies to maintain their property rights, and the health of the population is going to suffer across the world as a part of that. Could I just make one point about inquiries? During the course of my career as a senior public health doctor, I've been involved in setting up and taking part in and actually conducting inquiries, and I regard it as an extraordinarily important thing, this proposal for an inquiry. We need to learn the lessons. Independent Sage is very pleased that two of us from Independent Sage have contributed to this document, and we feel very strongly that it has to be properly scoped, and it has to do, in all my experience of inquiries when things have gone wrong clinically, the people affected, most affected, and it's really important that they are so front and center here, want three things. They want to know the truth. They want someone to admit they were wrong when they were wrong, and to say sorry and actually mean it. And the third thing is, they want to be sure that it's not going to happen again. And those three things must be achieved if we are to learn from this and to move forward in this. So Independent Sage absolutely supports what's happening in terms of calling for this inquiry, the full scope of the inquiry, and the importance of it taking place in the proper fashion under a proper chair.
Francis, you need to answer that.
Thank you. The TUC also supports the families and supports that call, and it feels so important at this time when we're looking at the spread of the new variants, because I know for sure that a lot of the problems in respect of workplace infection have not been tackled. So we still have very few health and safety inspectors on the ground. We still have a failure to report deaths that occurred through workplace infection. We still have an exhausted workforce in health and social care.